Hello everyone! So today I want to introduce you to Ozanimod, known by its brand name Zeposia. Ozanimod is a remarkable medication in the fight against two challenging conditions, multiple sclerosis and ulcerative colitis. Before explaining what this drug is and what it does, I'll quickly go over and explain the indications of this drug, multiple sclerosis and ulcerative colitis. Multiple sclerosis, or I'll call it MS from now on, is a chronic autoimmune disease that affects the central nervous system, including the brain and the spinal cord. In MS, the immune system mistakenly attacks the protective myelin sheath around nerve fibers, leading to a wide range of neurological symptoms such as muscle weakness, coordination issues, and visual disturbances. Ulcerative colitis, or UC, is a chronic inflammatory bowel disease characterized by inflammation and ulceration of the innermost lining of the colon and rectum. Symptoms can include abdominal pain, diarrhea with blood, and an urgent need to defecate, significantly impacting patients' quality of life. This is where Ozanimod, or Zeposia, comes in. Ozanimod is an oral sphingosine 1-phosphate receptor modulator that specifically targets S1P receptor subtypes 1 and 5. Ozanimod works by modulating the immune system, affecting lymphocyte circulation. By sequestering lymphocytes in the lymph nodes, Ozanimod reduces their presence in the bloodstream, thereby decreasing inflammation. Now, I would like to explain what Ozanimod does to our body. So, in multiple sclerosis, MS, Ozanimod modulates the S1P1 receptor to sequester lymphocytes in the lymph nodes, preventing them from attacking the myelin sheath around nerve fibers in the central nervous system. This reduces the frequency of relapses, decreases inflammation, and slows down the progression of disability, protecting against further neurological damage. In UC, Ozanimod limits the migration of lymphocytes to the gastrointestinal tract, reducing inflammation in the colon. This alleviates symptoms such as diarrhea, abdominal pain, and bleeding. Ozanimod helps patients achieve and maintain remission without the need for corticosteroids, which can have significant long-term side effects like osteoporosis, weight gain, and increased susceptibility to infections. So now I would like to give you guys some detailed evidence about the benefits of this drug. Clinical trials have shown that Ozanimod helps patients achieve and maintain remission without the need for corticosteroids, as I said previously, which are associated with significant long-term side effects like osteoporosis, weight gain. This makes Ozanimod a valuable therapeutic option, improving the quality of life for patients managing these chronic autoimmune conditions. Also, clinical trials and studies support the efficacy of Ozanimod in treating MS and UC. This might be a bit boring, so I'm not going to go into this deeply, but I would still like to provide you with some trial results. For instance, the Sunbeam Phase 3 trials demonstrated that Ozanimod significantly reduced annualized relapse rates in patients with relapsing MS compared to interferon beta-1 alpha. So, as you guys can see on the screen, I brought this paper so we could take a look at it together. It says that the incidence of treatment emergent adverse events was higher in the interferon beta-1 alpha group than in the Ozanimod group. Now we're going to take a look at another study. And in the treatment of UC, the Phase 3 True North study revealed that Ozanimod led to clinical remission in a higher proportion of patients compared to placebo. The study indicated that 37% of patients treated with Ozanimod achieved clinical remission at week 10 compared to 18.5% in the placebo group. So these findings underscore Ozanimod's potential to significantly improve disease outcomes and quality of life for patients with MS and UC, by reducing disease activity, preventing relapses, and achieving and maintaining remission without the long-term risks associated with corticosteroids. Now, I'm going to explain about the dosing schedule of Ozanimod. Ozanimod is an oral drug which is definitely so convenient for patients to take since there is no need for frequent hospital visits. You can just take them at home. It is very easy to take with a straightforward dosing schedule. So, you start with 0.23 milligram once daily for the first 4 days. Then, you increase to 0.46 milligram, which is twice the amount, for the next 3 days. From day 8 onward, the maintenance dose is 0.92 milligram once daily. Like any medication, Ozanimod has potential side effects. So I'm going to quickly go over those with you guys. The common ones include increased liver enzymes and upper respiratory tract infections, and less common are hypertension, nausea, and headaches. It is contraindicated in patients with a history of severe heart diseases, such as myocardial infarction, unstable angina, or stroke. Now, I would like to go take a look at the official website of Zeposia, which is Ozanimod. So here is the website, which is www.zeposia.com, and you will be able to find information about this drug on this page. So on the main page, you can see that the general information of Zeposia, it says 1 pill once a day. And as I explained previously, it treats 2 different conditions, which are UC and MS. Down below, there are some important safety information. Do not take Zeposia if you had some previous heart attack, stroke, or some kind of heart failure in the past 6 months. Also, you should not take this drug if you are taking monoamine oxidase inhibitors, which are usually used to treat Parkinson's disease or major depression. And you can see that farther down below there are some side effects. Now, let's take a closer look, and maybe you see, and I'm going to click this button. So you can clearly see the benefits of Zeposia. It is found that in clinical studies, people who took this drug achieved lasting remission. By the way, remission means that the signs and symptoms of your disease are reduced. It may be partial or complete. So Zeposia has proven results of lasting remission, which is of course means that this drug is highly beneficial. Another benefit of this drug is you can get UC relief without steroids. And down below, here are some people who've had Zeposia and experienced relief of symptoms. Since we don't have time, I'm not going to go over this with you guys together, but if you are interested, please take a look. Ozanimod offers new hope for patients with multiple sclerosis and ulcerative colitis, helping to manage these challenging conditions and improve quality of life. And if you guys are interested and need more information, you can visit the website down below or contact your healthcare provider today. Thank you.